our other partners in prevention, particularly the Center for Prevention Services. The substance misuse prevention professionals at CPS provide both technical and hands-on assistance with our local prevention efforts. I'm sorry, I have a clicker. She's going to do my clicking, so I'm going to look like a bobblehead because I do like this and she needs to click. And as you can see, they offer a number of prevention programs for our young people as well as for businesses in the community. I am particularly grateful for the assistance they provided to our Substance Use Task Force and to YSUP Rowan. Neetu Verma and her colleagues have been invaluable in our efforts. And did I mention that all their services are free of charge? Alrighty, so you've heard it today, YSUP, YSUP, YSUP. What in the world is YSUP Rowan? Well, YSUP Rowan is Youth Substance Use Prevention Rowan. You get it, YSUP with the wise owl in our logo. You get that? Cute, right? Well, let me introduce myself. I'm the fiscal agent. Liz Tennant is our project director. She is the one who got this initiative started and has brought it to where we are today. Unfortunately, Liz is going to be leaving us in a couple of days, but I am pleased to announce that Lauren Alexander Hurst is going to be our new project director. We're really looking forward to the things that she's going to do with the coalition. Our vision is for our youth, families, and community to be safe, healthy, and drug-free. And our mission is to inform and engage the community in creating conditions that will lead to the prevention and reduction of substance misuse by youth. YSUP Rowan was founded in 2015. And in 2017, we were awarded a $125,000 per year, 5-year grant from the Office of Drug Control, the White House Office of Drug Control Policies, Drug-Free Community Support Program. And that, we have an automatic 5 years, so that's $625,000. And if we accomplish our goals in that period of time, we should get another 5-year renewal of that for a total of 10 years. Now, who makes up YSUP Rowan? Our DFC, our Drug-Free Communities Grant requires that we have representatives from 12 sectors in the community. They include the business community, the faith community, education, law enforcement, recovery, those folks. And as you can see, this is a list of the folks around our table right now. And one of the things I want you to notice is that there's an empty circle up there. And that empty circle is for you. So if you're interested in joining YSUP Rowan, come along. Now, what is a coalition? Well, CADCA, which is the Coalition for Anti-Drug Coalitions of America, defines it as a formal arrangement of collaboration in which we all work together but retain our individual identities, and we work toward the same goal. Now, community coalitions differ from prevention programs in several ways. In scale, they're usually a little bit larger. They usually have a little bit more ambitious goals. Oftentimes with community coalitions, they focus on multiple causes. And usually they're comprised of a lot of different actors. Now, there are various types of community coalitions. You have your activity coalitions, and that could be folks that do poster contests, resource directories, help fairs. Then you have your service and program delivery coalitions, which may offer mentoring programs, after-school programs, parenting classes, and in those kinds of groups, staff are usually involved in direct service delivery. Then you have community mobilization coalitions, and they organize usually around a single issue or a set of issues. For instance, restricting alcohol and tobacco billboards near schools, or eliminating the sale of drug paraphernalia in local stores. But what we are at YSUP is a comprehensive community coalition, and we are working to develop and implement multifaceted plans to lead to measurable population-level reductions in one or more substance abuse problems. So why is this important? Well, because for YSUP, to affect community-level changes in adolescent substance use and abuse, we must be purposeful in applying our time and resources to efforts which target community-level issues. Now, does that mean that we can't conduct activities or provide service or address specific issues? Absolutely not. But we must do those things within the context of our overall mission and using data to drive us. Now, at YSUP, we're using the Strategic Prevention Framework. And this is, the thing that I want you to notice about this is it's a circle. So it starts with assessment, and then we go to capacity building, and then we go to planning, implementation, evaluation, and then it keeps on going around and around. And in the middle of this, you'll see sustainability and cultural competence, which are embedded into all of the facets. In working in this model, it allows us to work from the problems to outcomes to strategies to activities, as opposed to activities, strategies, problem, and then outcomes. So that we begin the process knowing what the problem already is, and we can design strategies to effectively implement. Now, the first step in the process is the assessment. And now, this is a little bit different from the United Way Needs Assessment or the Community Health Assessment. We use their data, certainly, because it was wonderful, and we've gotten data from a lot of you folks around the room. But we focus here on ours also on the resources within the community. And if you can see on the slide, you've got the faith community, you've got the business community, education. So we look at all those things that already exist within the community as well as the needs of the community. Now, through this process, with the assessment process and our planning process, we have gathered lots and lots and lots of data. There are many of you in this room who have been instrumental in helping us get that data. Well, why do we need all that data? I mean, we know there's substance abuse problems. Why do we need that data? Well, before we can address a solution, it's kind of like looking through the lens of a camera, that you see an object in the distance, and then when you train your lens on it, it becomes clearer and clearer and clearer until you finally get a close-up of what exactly is the problem that we need to address. Now, this is an example of some of the data that we have collected. And thank you to Carolyn Haupt, I see her over there, for helping us get this data from the schools last year. Now, this is on our underage drinking, and this is about past 30-day use, perception of parental approval or disapproval, perception of peer approval, and risk. The blue is purple is middle school, and the orange is high school. So as you can see, these are high, and that's a good thing, because we want kids to perceive that their parents would disapprove if they were underage drinking. And we want them to believe that their peers would disapprove of that. And we've got about maybe 15% or so, maybe a little bit over 10% of high school students who report past 30-day use, and a little less than that for middle school. We do not have the data on the perception of risk. Now, this one's prescription drug misuse, and it's pretty much the same, but as you can see with their perception of risk here, this is very high, and that's very good. We want them to perceive the risk of using prescription drugs that are not prescribed for them. Here's with tobacco use, and the same kind of thing. Now, the thing that I want to point out on this slide is that this was specifically asking about tobacco use. This was not asking about Juuls, it was not asking about e-cigarettes. If we were to ask that question again today, I think you'd see a very different in that past 30-day use, because as Nina said, we are seeing those electronic cigarettes, those Juuls, we're seeing that use skyrocket. Now I have to catch up to myself. Now this data, the next slide, this is data that we have collected in 2018 and 2019 from parents. And it says, do you believe X is a problem? The first category is, do you believe alcohol is a problem? And you can see there's just a slight difference between 18 and 19. And then, do you believe tobacco is a problem? And you can see that that's increased from 18 to 19. And I would imagine that part of that change is a reflection of the Juuls. Then we go to marijuana. Well, we're seeing a little bit more that they believe that's a problem in Ryan County. And then prescription drugs, which is I don't know if it's a statistically significant increase, but it's a fairly sizable increase. Now, this is a question that we asked of parents do you secure substances in your home? And we again go from 2018 to 19. Do you secure alcohol? Do you secure medications in your home? Now, you can see that this is a huge increase, and I do not want to take credit for all of it from YSUPs, but I will, because we have been hammering home that, well, you take your credit where you can. We've been hammering home the importance of locking your medications and alcohol. And so we distributed, and you'll see a slide later, we distributed a lot of lot boxes and just a lot of information. So this really is significant. And parents, we ask the parents, we assume that they're going to be honest, but we like the trend that this is going. Now, so we got all this data, and so what happens? Well, we collect it to determine objectively, not subjectively, what the problem is in Rowan County. Our DFC grant, Drug Free Communities grant, requires us as a coalition to focus on 2 substances. And we selected underage drinking and use of prescription medications that were not prescribed for you. We are also adding in a focus on e-cigarettes and Juuls, but those are our 2 primary focus areas. So if we've decided, and I'm just going to focus on underage drinking for today's purposes. If we're going to focus on underage drinking, we've used our data to say the problem is underage drinking. So after we determine that problem, then what we have to ask then is, but why? Why are underage youth drinking alcohol? Is it because adults don't think underage drinking, particularly in certain circumstances, is a bad thing? Is it because alcohol is readily available to underage youth? Well, that takes us to the next question. But why here? Are parents allowing underage youth to drink under their supervision? Are underage youth allowed to consume alcohol at family gatherings or parties? Is underage youth drinking considered a rite of passage? Are underage youth able to find places and times where they can drink without adult supervision? That allows us to answer the but why here. And Rowan County's answer to but why here may be very different from other communities. Now, I really don't expect y'all to read all of this, but this is our logic model. Now, I love logic models. There are people in this room who do not, but I love it. So I have to sneak this slide into every presentation. What we've done with this, with this data is, we have taken that but why here, that underage youth are drinking at teen parties, proms, and after-school sporting events, and we're coming into community norms, which is apparently the community norms in this are that it's not really that big a deal for kids to do that. We did the same thing with accessibility. They are accessing drinking alcohol at home, and then this one says we got the data that parents do allow their kids to drink, and they are able to access, which brings us right back to our underage youth drinking is our problem. Now, what do we do from there? Sorry about that, y'all. Next slide. Well, we use the 7 strategies to affect community change, and there are 7. And Lauren, you can just click through all until we get to 7. First is providing information, and that's just educational presentations, enhancing skills, and we're going to increase the skills of participants in classes, providing support, offering opportunities to participate in activities to reduce risk or enhance protection, enhancing access, reducing barriers, making it easier or harder for kids to access substances, changing consequences, altering the consequences of behavior, or providing rewards for good behavior. Physical design, reducing the risk or enhancing protection. I know City of Salisbury is doing a lot with lighting and vacant houses and things like that, which are places where kids can go and use substances. So once you get rid of that, once you change that design, you mitigate their ability to use those substances. And modifying and changing policies. Now, the first 3 categories are really about educating the public, raising awareness, and helping individuals make better choices. And those strategies usually affect a smaller number of people, but they are really important to bring awareness about substance misuse problems and to rally community support. The last 4 are environmental in nature, and when they are implemented in a multi-strategy plan like we have, can form the basis of a comprehensive approach for substance misuse prevention. Now, and you can just go on through this whole thing too, Lauren, thank you. Now I'm using our underage drinking here, and here if you go back to those 7 strategies that I just mentioned, well, how is YSUP Rowan going to apply those to underage drinking? Well, we're going to create and disseminate information on consequences. We're going to hold parent workshops. There's some really good talk they hear you and then talk it out. That's federal and state level materials. We're going to provide support by creating a parent blog on our website. Enhancing access and reducing barriers. We're looking at after-school opportunities for middle school students because we know that's a critical age. Changing consequences. We are looking to initiate student-led resources to encourage alcohol abstinence. In physical design, we're working on an alcohol cabinet lock campaign. And in modifying and changing policies, we're exploring the feasibility of a social host ordinance for the city of Salisbury. Now this is how YSUP is, this is how we've spent most of our time, and as you can see, the bulk of it has been on providing information. Well, that's kind of like tilling the soil and planting the seeds, because we are creating that awareness in the community about the need for community level substance use prevention. Here are some of the things that we've done. We've got our mock bedroom. I'll talk about that in a second. We've done a lot of presentation. Oh, and by the way, our mock bedroom is mobile, so you call, we go. We have these YSUP memory sticks. These are USBs, and they are loaded with information about youth substance use and prevention, information about YSUP, and we're getting those out. So we're doing a whole bunch of different things. And as you say, we've got newspaper articles, and thank you to the Post for helping us with that. We did things with the National Substance Use Prevention Week this year with a sticker shock campaign on pharmacy bags, and we will be doing a similar campaign, sticker shock with alcohol. Last year, we coordinated with this task force to bring Sam Quinones, the author of Dreamland, here. We participate in community events. And then we do have our hidden in plain sight mock teen bedroom. I encourage you to walk over there. What we want parents to do is to look. There's nothing hidden in there. There's nothing under the beds. There's nothing under the blankets. There are a whole bunch of things in that room that we as parents or grandparents, if we walked in, look like perfectly normal items. And they are either drug pipes, or they're places you can hide drugs, or they're things that are used to cover up drug use. So we encourage you. We've gotten really positive feedback from that. A lot of aha moments from parents. So we encourage you to do that. I have to give credit where credit is due. We got $1,500 from our Salisbury Elks Lodge and Elks Foundation grant for us to buy those materials. And we're looking for a trailer so that we can move it around. And this is just an example of a trailer that we may be looking at. Now, how are we going to know that we're making a difference? Well, we have established certain goals that are short, intermediate, and long-term goals. And I'm not going to go over these individually, but what's important for you all to recognize is that we know where we're going. We know where we want to go. Let me rephrase that. So we will be continually collecting our data to measure our work against this, and constantly, if we need to be changing what we're doing to improve our outcomes, we will be doing that. Now, how are we going to let the community know that what we're doing? Well, events like this, and through our social media accounts, in the newspaper, radio, anywhere we can get our word out. And who should care what we're doing as a coalition? Well, families and friends of people who misuse, our first responders who see it every day, businesses who struggle to find and retain good employees, local hospitals whose ED visits related to substance use have increased dramatically, our schools and social services, and you're going to hear from Donna Faco later, who are trying to meet the needs of children impacted by substance misuse, and the citizenry in general, who may be victims of crimes related to substance misuse and whose tax dollars are required to address the consequences. YSUP is in the business of changing lives. We can use your financial help, in-kind support. You can join YSUP or allow one of your employees to do so. You can sponsor a youth council member's attendance at CADCA's leadership forum. Include us in your advertising, post YSUP information in workplace, and share. And then the next slide is, in particular, we are really seeking support to help find us a trailer of some sort so that we can take our mock bedroom on the road. We would love to be able to take it to open houses, to schools, to civic groups, wherever. It gets a little bit hard to manage. We're now carting things around in our cars. So if anybody has any resources like that or knows of any and you'd like to share that, please do. Next slide. And again, and the final thing, here's my biggest pitch for you. And I think we've actually recruited several people here today, Abigail, to be part of our YSUP Youth Admins team. This needs to be a youth-led effort. And we are really, really looking for young people who want to be part of this and who want to be part of an effort to reduce adolescent substance abuse, that they're the leaders. We don't want to tell them what they need to be doing in the youth admins. We want them to come up with the ideas. We want them to brainstorm about it. So if you know of anybody, please, we've got cards over there. Lauren's cards are over there. We've got information. Please do share that with them. And I'll close with this slide. Each one of us can make a difference, but together we can make change. Thank you.